Abortion opponents don't trust women to make up their own minds. They argue that bans and restrictions protect a person's physical and mental health. But that paternalistic argument of saving women from making their own decisions has been used for decades to defend abortion restrictions, yet the opposite is actually true. Yep, what most women feel after their abortion is relief. Research from Nationwide Turnaway Study found that nearly 99% of women who were followed for 5 years have no regrets about their abortions. Study after study has shown that getting an abortion does not, in fact, cause mental health problems. That false narrative is entirely based on, well, personal and moral opinions. But you know what does affect one's mental health? Being forced to carry a pregnancy. Research overwhelmingly shows that limiting access to abortion care and robbing a person's right to control their own body and future leads to a significant increase in anxiety and depression symptoms. In fact, a 2024 study from the Johns Hopkins Bloomberg School of Public Health found that people who lived in states with abortion bans had worse symptoms of anxiety and depression than those who lived in states without bans. And another study found that those who were denied an abortion reported worse health and greater chronic pain than those who were able to terminate their pregnancy. Not to mention the other negative effects like poor maternal bonding, lack of support, and poverty. On the other hand, those who had an abortion reported greater financial security and in turn raised their children under more stable conditions. As OBGYN Dr. Amna Dermish put it, when we're forced into a decision that doesn't feel right, we know that it has negative mental health impacts. See, what abortion opponents frame as an abstract moral question is really a question of freedom and agency that should focus on the humanity of a pregnant person. Even prior to the Supreme Court Dobbs decision that ended federal abortion rights, the US already had the worst maternal mortality rates among high-income countries and a dangerous mental health crisis. And now that abortion access is out of reach for more than 20 million women of reproductive age in their home states, plus trans and non-binary people, it has likely exacerbated those conditions. Everyone should have the freedom to control their own body because restricting that freedom puts people's mental health and ultimately their lives at risk.